Welcome to the campus of North Idaho College and today's broadcast of the North Idaho College Public Forum. The crew is comprised of North Idaho College television students. Your moderator is North Idaho College political scientist Tony Stewart.
I wish to welcome you to part 3 of a 4-part series dealing with the subject of art in life and leisure. This is a program that's put on by the Convocations Committee at North Idaho College, and we're very happy to bring you this third program, and we'd like for you to be with us next week when we bring you the final in that series. Today's guest is Dr. Rowley Silver, who has a BA degree from Cornell University, a master's from Columbia University, and a Doctor of Education from the Teachers College at Columbia University. Her subject while with us on campus to speak to the students is assessing and developing cognitive skills in handicapped children through art. That is what we've invited her to this program to discuss today, or anything that relates closely to that. Dr. Silver is also the director of a project entitled Assessing and Developing Cognitive Skills in Handicapped Children Through Art that was funded by the National Institute of Education. Dr. Silver, welcome to our program.
Thank you for inviting me. It's a pleasure to be here.
I would like to welcome back a permanent member of the panel that's been gone, and we're happy to have you back, Lou Reed.
Thank you, Tony.
Holding a degree from Mills College and did her graduate work also at Columbia University. We're also happy to have Neil Everett, who's a member of the faculty at North Idaho College, visiting with us on the panel, and Doreen Rogstad, also North Idaho College faculty. Welcome to all of you.
Thank you.
I would like to invite the series of questions, starting with Mary Lou Reed.
Dr. Silver, let's lead into this with your topic that deals with the role of art for deaf and aphasic children. I had to look up aphasic. I understand it means speechless. Would you talk about what it's like to be a deaf child and how art fits in a therapeutic way?
Well, I'd like to say something about the word aphasic because that was a doctoral project in 1966, and the word is no longer acceptable. Aphasia generally refers to, is used now for an adult. So it was used at that time, but it's no longer really
What's the word that we can use then?
Well, you would use deaf or hearing impaired, but a child who has, or learning disabled child, or language impaired. But aphasia generally refers to an injury to the brain that comes after development, not a developmental one.
Thank you for clearing that up.
That's my own correction of my own doctoral project.
And then I really am curious about the special hostilities and special frustrations that a deaf child has that where art can help bridge some of those problems.
Well, the essential problem, I think, of deafness is a lack of communication. It's not just hearing, but it's not hearing what is being said and not communicating with other people verbally. And what particularly interests me is that art or drawing can serve as a substitute for language. And a child can use drawing not only as a means of expression, but as a means of learning. And we're particularly interested in our work in teaching concepts that are normally developed through language, through drawing. And this is what we have been doing, drawing, painting, modeling clay. So it's a two-way communication, both to take in the concepts through drawing and to express them through drawing or modeling or painting.
So you feel that there are three functions then, the therapeutic and the communicative, and then also the one which is basically learning, educational.
Yes. And that's particularly my interest, is the developmental area.
Thank you.
Neil Everett.
Dr. Silver, has photography played a part in your work? And if so, could you expand on that a little bit in teaching with the children?
Only to the extent that I have slides of their work. But otherwise, no. Photography has been used. I've never used it with them. I'm an amateur photographer myself, but it's a marvelous area, and there are people who do use photography.
I would think that it'd be a very visual thing, that it might be possible to use that also.
Yes.
Thank you.
Doreen Rogstad.
In working with young deaf children, did you find any relationship between art ability and intellectual ability?
Well, you're asking the $64 question. In 1961, when I started with this, the tendency was to feel that deaf children, because they have language impairment, were not very bright. And it was because I knew that these children, that one child in particular, was very bright. But no one would test him, there was no way of knowing whether he was bright, and the assumption was that without language, that there was nothing, so you had to start with language. So it seemed to me it was like trying to make a child with one leg run. He was never going to get language. He's now 24. He doesn't have language. But he was marvelous in art. As an 11-year-old, a 14-year-old, now he's 24. I will show slides of his work tomorrow, and I think that you'll be amazed, not only when he was 11, but in fact, the drawing he made when he was 11 was a logos for the Smithsonian Institution traveling show called Shout in Silence. It was his drawing. So the answer, I think, is that very often deaf children are very bright, and the problem is to tap that intelligence. And that's why I think one way to do it is through drawing. All right.
Have you used the Good Enough Harris Draw Man scale test?
I haven't used it. It's a good one.
You feel
but my drawing test correlates with that. Mm-hmm. In the past year, a study we made had two objectives. One was to assess a drawing test. Another was to teach, trying to teach concepts through art. Not just deaf children, we're working with learning disabled children or language impaired children. What was your question? I'm afraid
I wanted to
and one of we gave the test, and we had volunteers around the country gave the test to the drawing test to their children, and sent us the scores on standardized tests of intelligence. And our psychologists found significant correlations with various groups, some small, but up to 99, and significant. In other words, the drawing is tapping cognitive skills that are normally tapped verbally, and the Draw Man test is one of them. Also the WISC, the Wechsler Intelligence Scale for Children, and the Wechsler Intelligence WACE, the adult, and the Otis Lennon, and the Iowa, and the MAT, reading and math, and the SRAs, so that's what we've been doing.
Okay, Lou Reed.
Would you push this just a little bit further, because I'm not quite sure I know what you're talking about. Would you give an example of how, I can see how you can use art to assess cognitive thinking or conceptual, but how would you teach concepts or substantive matter through art? Would you say how you would go about it?
There are three concepts that we're particularly concerned with, and these concepts have been cited by Jean Piaget as essential in reading and in mathematics. Mathematics is Piaget's citation, mm-hmm. and other people seem to be talking about the same three concepts in reading. This is Bannatyne, Smith, Bruegel. These are people who use the WISC subtest scale into three categories, and the same concepts seem to be in both arithmetic and reading. And these are concepts of space, concepts of sequential order, and concept of a class or group of objects. So these are in the drawing test, each subtest, the drawing test has to do with one of these concepts. And then the teaching materials have to do with these concepts.
Right. So how would you use, say, clay to teach sequential order?
Well, you could have a child make balls, from small to large. But that would let me say use paint rather than clay.
Yes. Use your own form. I was just trying to put it together.
You can use clay for all of them, but it is not as specific. So let's say paint. This is the teaching procedure now. The children use paper palettes or just a piece of white paper, we use poster paint, and we use a palette knife. You can use a stick. You can do without a palette. You can do this very economically. But you treat the poster paint just the way you would oil paints. We give them the three primary colors: red, yellow, and blue, and white. And you might put a dab of white here at this corner of your palette and a dab of blue here. And you show, you can do all this without words. You demonstrate taking a little bit of white and a little bit of blue and adding a little bit of blue to the white and putting it here. Then you add a little more white, a little more blue to the white, and you put it here, so that you make a sequence, a string. And you demonstrate this, and then the child puts white on his, and he demonstrates mixing a series of blue tints going from pale to dark or dark to pale. And then you might put say red here, and you have a series of pink. And this is really, it's learning how to paint. It's also learning to sequence. And the more you add of one color to another, in fact, every time you mix, you're sequencing. So you do that with all three colors, the three primaries in white, and you mix orange and you mix green from your, and you mix tints. We used to use black, but we dropped that out. Shades, it makes it too muddy. But that's how you would sequence, for example, with paint.
And they do it by example then? They follow
a demonstration.
Demonstration.
Right. You can do anything in art almost without talking, because you can just do it. And the point is not to have a child follow your model, but to demonstrate just long enough for him to get the idea and then go off and mix his own colors.
Fascinating.
In other words, discover. The point is to discover what will happen. You'll say, what's going to happen if you mix red and yellow? Some know, some don't.
Ladies and gentlemen, if you've joined our program in progress, you know that we're going through a series entitled Art in Life and Leisure. It's been the convocation series at North Idaho College, and this is program number 3. Our guest today is Dr. Rowley Silver, who holds a bachelor from Cornell and a doctorate from Columbia University. Her topic while on our campus is assessing and developing cognitive skills in handicapped children through art, and that is what we are discussing here. We shall continue the questioning with Neil Everts.
Doctor, to move along a little further in that area, do you make judgments as a child progresses on things in composition and that kind of artwork, or is that?
No, it's primarily subject, the content rather than the form. It depends. If we're dealing with images, with communication, it's a message. We emphasize a meaning. In other words, you don't have to draw well as long as you can represent your idea, as long as it gets across. That's the important thing. On the other hand, with other areas like drawing from observation, which is where we're talking about concept of space now, then form matters very much. And you evaluate the work, really. Composition would certainly be a factor in evaluation. We score the drawings, by the way, in a scale of 1 to 5 points. And a drawing that takes into account the whole paper would get a higher score, say, than a drawing that was just in a small part of the paper.
Would this sort of be a progress series also?
Oh, yes. Yes.
Thank you.
Doreen Rogstad.
Since handicapped children don't have the same relationship to their environment as, say, non-handicapped children, did you find a difference in their art?
Essentially, no. Except that I think you would find talent more among the handicapped. Certainly there was with language handicaps, because they're so much more motivated, there's so much more satisfaction. There are so many limitations in the things that they can do and do well. And drawing is one area. If a child doesn't have a visual impairment or a motor impairment, he can do as well as a child without any impairment, and even excel. And this is what you will find. Expectations tend to be low for the handicapped, unrealistically low. And I think if you see some of the slides, you'll be amazed. You say you wouldn't believe, but there's a tremendous amount of aptitude that is not tapped.
Do you have to have a special kind of environment to work with them, like on a one-to-one basis, or can you work with small groups or anything different?
If we're talking about deaf children, and for the past 5 years I've been working with learning disabled children or stroke patients, for example, with language impairment. But the deaf child is so aware of what's going on. He pantomimes so well that they they learn it faster than anybody else. They take it in. The child knows what's going on in the desk behind them. They have eyes behind their head. So, and they can pick up so quickly from what you do, because there's no handicap whatsoever. If they see what is done, they can do it. So the answer is they're not slower at all. It's very slow if you want to talk. If you want to get a verbal idea across, it takes forever. But if it's something you don't have to say but can demonstrate, you can draw your responses. You can have a conversation in sketches.
Have you worked with really young, like preschool?
No, this really starts with the age of 7, because it is about the age of 7 that children are able to represent their thoughts through drawing, and this is what we're after. Once a child can represent a man, draw a man, for example, and do more than just draw a man, but show a man doing something, then we're communicating. Then drawing can be used to communicate ideas.
This might be a good time, Dr. Silver, to lead up on Doreen's question and ask about your project that took place in 1979, 1980, that we've mentioned several times. How many students were involved in this, and how was it funded? And but most important of all, what kind of numbers are we talking about as far as individuals involved in its success?
There were 5 schools involved with this. 5 of my former students at the College of New Rochelle, where I have been teaching since 1974. They're now out, and there are teachers, art therapists in the field, and these were very good teachers. In fact, this was all to test out the teaching procedures we had used earlier. I have been teaching a course in the graduate school in which the graduate students work one-to-one with a handicapped child. This was a course, and they use certain procedures. Whoever enrolled in the course was working with a one-to-one child. So we've had statistically significant gains with these concepts with the children. This time we wanted to do it properly in a real project in a real school. So 5 of my former students each worked in a different school. One in a school for learning disabled children, where she is the art teacher, art therapist in the school. The others worked in schools that for normal children, but who had classes for children who were mainstreamed otherwise. Sometimes they were handicapped children, sometimes they were children just with some special educational needs. The children were nominated. In each school, we asked the principal to give us 35 children who were at least 1 year below grade level in reading or math. And from this pool, we gave all these children the drawing test. Our plan was to take only those children who had a high score on the drawing test. But we didn't have enough children who had high scores on the drawing test, as it happened. Occasionally, we did. If I can digress for one very moment, a teacher in Canada was interested in the procedures, and she was one of the volunteers who gave this is Owen Sound, Canada. She gave the drawing test to all the children in 1 3rd grade class and sent us the scores of the children on the Canadian Cognitive Abilities Test. And in this school, the child who had the highest score on the drawing test had only an 81 IQ in the Canadian Cognitive Abilities Test. Aside from this one child, the children who did well in both tests, if they did well in Canadian Cognitive Abilities, also did well in the drawing test. The child who was low in one test was also low in both. But this one child had the highest in the drawing test. So this teacher, we worked long distance via mail and telephone, and she worked with the child using the same procedures that we used all along. So this was one child that really had high score to begin with. In the meantime, all the teachers used the same procedures for the first 6 weeks. In the second 6 weeks, the teachers were free to devise their own procedures or adapt them to the needs of their children. And then we had a post-test at the end. The results were that the experimental group, you said numbers. We ended up with 84 children, half experimental and half control. We started out in each school with 10 in the experimental group and 10 in the control. So we started out with 100. but some children dropped out, and then the psychologists who handled the statistical area reduced the children, so we ended up with 84. The experimental group had significant gains, as before, but the control group also gained, but not significantly. We were talking now the 84 children. Individual children, again, a few made extraordinary gains in IQ. It carried over to everything else. Just a few individual children. And the school that was most successful was a school for learning disabled children. We don't know why, but they had statistically significant gains as a school.
Lou Reed.
Well, how well accepted is the importance of art as a teaching tool in schools for the handicapped? Are you pioneering to some degree? You obviously must be if you're still doing some experimental testing.
There are many people in the field now.
Would most schools, say for the deaf in a place like Idaho or the state of Washington, would they be using art?
I don't know, but
to a great extent?
I don't know that schools for the deaf are particularly interested. I don't know. Art therapists are interested. Art therapists is a new group, really. It started in 1969. It's the American Association of Art Therapy. It is special use of art for therapy. It started out really with people who were mentally ill, emotional problems, and it is, of course, primarily that way. Our particular area is a cognitive area, but it also is considered art therapy.
Neil.
I think I'll pass. Pass it on to Doreen.
Doreen.
Okay. You've done so many fantastic things with art and been so many places. I'm wondering if you've run into any problems with people or groups of people who think that maybe we're spending too much money for art. It's more play. Art is play and rather than a communicative.
Well, this has always been the way. Art is considered entertainment primarily. It is not generally known that it is potential for quite apart from the aesthetic. And I must add, I haven't mentioned it, but I came to this as a painter. I am still a painter. I've had several one-man shows, and I consider the aesthetics extremely important. And because I was sure that this one approach enhances the other. In one of the studies, it was a 1973 project. This was a state urban education project. We had a professor of art from Columbia and an art therapist evaluated work blindly, not knowing who or what. They had the first and last work and the mid-work by each child in that particular study. It's a 1973 study. They did not know which was early and which was late, but when they evaluated, both found gains that were statistically significant from an aesthetic point of view, from an art point of view, nothing to do with the cognitive. So I'm convinced that they go together, hand in hand. They enhance one another.
Does this mean that good art really does have to then contain a certain semblance of conceptual? Of course. You're saying design.
Right. Yes.
Another question I have along those lines, since you're certainly an expert in the field, of those handicapped children that you've worked with, especially in this project, is there any other characteristics that you could share with us that indicate that some of those children progress more rapidly than others, other than such things as the IQ test, so forth, their background, socioeconomic, or if there's a difference in the age at all, or male or female? Did you find any other significant statistics?
You're asking about the children who made extraordinary gains.
Yes.
I was talking just yesterday to the principal of the school where this happened too, with a little girl, because we don't know really why. He said a little girl, and the ages of the children, by the way, are about from 7 to 11. This little girl had significant gains in all her intelligence tests, unbelievably. And I asked him why. The fact we made a mistake in having 6 of the art procedures were identical and 6 were not. That brought in so many variables that you don't know what happened. So from now on, we're going to have 12 sessions exactly the same and then a variation. So he said he thought it was the chemistry of this little girl with that particular teacher, a very warm, supportive, marvelous person. Her name is Eldora Beauvais, and she's about my age. She came to all this quite later on in her life, and a very marvelous, supportive person. And the principal said, well, the chemistry was just right. She changed this little girl from a non-person, as he said, to a person. And I think that if that's all it is, if it's just the attention, then our techniques are not particularly valuable. If it's the techniques, then it can be replicated. But she was not the only child, but she was one, again, who had extraordinary ability, extraordinary change.
Lou Reed.
Well, you just have a couple of minutes left with us, and so I think perhaps I'd like to ask you to summarize, if you were going to say this, what your central message is in the role of art in education, what is the point that you would like to stress again?
That's a tall order. I think I would say that when people have handicaps or children have handicaps, we're so overwhelmed with the handicap that we don't look at the strengths, and that there are enormous potentials for growth and all sorts of contributions that are bypassed as a rule. They may not necessarily be art, but certainly found in art, and that there's a lot of potential, a real contribution that can be made by the handicap.
With that, let's bring our program to conclusion. I want to thank you, Dr. Silver, for being with us. You have certainly shed some light on a terribly important topic. Thank you very much.
Thank you. It was a pleasure to be here.
I also express my appreciation to the panel. Ladies and gentlemen, today our guest has been Dr. Silver, Dr. Rowley Silver, and she's been discussing with us a topic that we think is most important, that is assessing and developing cognitive skills in handicapped children through the use of art. We are in a 4-week series dealing with the topic Art in Life and Leisure, and we want to express our appreciation to the Convocations Committee for sharing these guests with us at North Idaho College. We hope you'll be with us again next week when we'll finish this series in part 4. And our guest that week will be Dr. Nellie Arnold, and she's going to be talking about art in leisure. Please have a good week. I am Tony Stewart.
The North Idaho College Public Forum can be seen at this same time each week over this station. This production was videotaped earlier by a North Idaho College student crew for viewing at this more appropriate time.